Hi, it's Jessica, neonatal nurse practitioner student, and today I want to talk a little bit about HIE or hypoxic ischemic encephalopathy. And for those that do not know or are not aware, April is also HIE Awareness Month. So HIE is a brain injury that happens to the baby, and it's caused by oxygen deprivation that can stem from a multitude of things that happen either during the pregnancy, during the delivery, or shortly after birth. So I'm just going to kind of talk about some known causes of HIE. Does not mean that this list is inclusive, but these are usually the known terms that you may hear associated with HIE. So placental abruption, placental insufficiency, if there is a cord prolapse or cord compression, or even multiple nuchal, which is the cord wrapped around the neck, if it's essentially wrapped around multiple times, so you might hear nuchal times 2 or times 3. There also might be a uterine rupture that occurs, might be prolonged or difficult labor, as well as shoulder dystocia. So HIE, of course, is a very serious condition that can lead to long-term disabilities, including cerebral palsy, developmental delays, and learning difficulties. And of course, in some cases, it can be fatal. So I want to talk a little bit about kind of the NICU role of HIE and how it is managed in the NICU. So first things first is we're going to get a blood gas and see what the pH is of the blood gas, see if the infant is a candidate for something called therapeutic hypothermia, also known colloquially as body cooling. And so we have specific criteria to see if the baby potentially is going to meet criteria to be cooled. Traditionally, the gestational age does play a factor in the role, the birth weight as well. But most important, besides the birth weight and the gestational age, is going to be the onset of the hypoxic event. This needs to be identified within 6 hours of the hypoxic event. And there's something that we also use that is called the SARNAT, SARNAT scoring tool. And that kind of gives us an idea whether the HIE is going to be mild, moderate, or severe. So the things that are assessed with the SARNAT score is the level of consciousness, if the baby is showing any spontaneous activity, if how their posture is, if they're posturing, which we know posturing usually is associated with a neurologic component, how their tone is, if they have any primitive reflexes such as the suck or Moreau. They also going to be looking at their autonomic system as far as their heart rate, their respiratory rate, as well as their pupils. And then, of course, once the cooling is started, traditionally we also place these infants under a EEG monitoring for seizures because they are at a high risk for seizures. So as I said before, the goal is to initiate the thermal hypothermia at least for the first, within the first 6 hours of the oxygen deprivation event occurring. And we want to continue the hypothermia for at least 72 hours. And then after that 72 hours, the baby is then gradually rewarmed. And ideally, if you are at a facility that can have an MRI, then they are going to be scheduled for an MRI. And one thing that I want people to understand, even though the baby may have qualified for cooling, it's going to depend on how severe the oxygen deprivation was to the brain. The cooling essentially stops what has occurred, but it does not revert or it does not correct any of the issues or damage that has essentially been done to the brain. So in my practice as a neonatal nurse, I have seen many instances where baby was able to be cooled within that 6-hour window. We got it initiated. We were able to then cool the baby for 72 hours. Baby was then able to be rewarmed, had the MRI, and had some mild HIE. And so, of course, we don't know how severe the long-term outcome is going to be because, of course, we're just in the NICU at that point. But I have also seen situations where we initiated cooling, we rewarmed the baby, and unfortunately, the MRI was not showing a good outcome. And unfortunately, the parents made the decision to withdraw of care. So HIE, I just want people to be aware of how it happens, things that lead up to the hypoxic event, and kind of management, how we deal with it in the NICU. I do want to reiterate that even though we may initiate and the baby might be able to be discharged home, that these kids are usually followed pretty significantly by neurology. They may still have some developmental delays. They may still have some deficits. It does not mean that they are completely out of the woods, just by us being able to get them cooled so that way they are able to be sent home. I encourage you, if you have any more questions about HIE, especially if you're a parent, to go to this profile account that I've got linked, HIE Awareness. She is a great advocate. She's also a parent who's been through this before. So if you have any questions that I maybe did not address in this video, she's definitely a good resource. Thanks for watching.